You feel it before you realize you're doing it. That small, quiet clearing of the throat in the middle of a sentence. Again at dinner. Again on the phone with your daughter, until she finally asks if you're coming down with something. And you give her the answer most people over 60 give. It's just allergies. It's just age. And that mistake can hide something serious for years. For many older adults, that answer is wrong, and it stays wrong for years. There is a condition that specialists at the Cleveland Clinic literally call silent. Silent because it can burn the throat and the voice box day after day without producing a single second of heartburn. And because it produces no heartburn, it gets mislabeled as allergies, as a lingering cold, as a nervous habit in people in their 60s, 70s, and 80s. And that is only one of 5 distinct causes we are going to walk through today, including one that may be sitting in your medicine cabinet right now with your name printed on the label, and one set of warning signs where waiting is the single most dangerous thing you can do. In the next 20 or so minutes, I'm going to walk you through exactly how silent reflux is different from ordinary acid reflux, and why it fools so many people. The specific class of blood pressure medication that is documented in multiple published reviews to cause a dry, nagging cough in some of the people who take it. The gland in the front of your neck that can make you feel like something is stuck in your throat when nothing is there. The short list of red flag symptoms that the American Cancer Society and the National Institutes of Health say should send you to a doctor within weeks, not months. And the evening habits that may be feeding the whole problem. And I will tell you now, the last trigger on that list is the one your own kitchen hides. And it is probably part of your nightly routine. Before we start, one honest sentence about who is talking to you. I am not your physician, and this channel does not diagnose anyone. What I do is read the published guidance from institutions like the National Institutes of Health, the American Cancer Society, the Cleveland Clinic, and Mayo Clinic, and translate it into plain language. Every claim in this video is anchored to one of those named sources, and everything here is education, not medical advice. Your own doctor makes the calls. Let me tell you about Margaret. Margaret is not a real patient. She is a composite, built from a pattern that repeats over and over in older adults, but every detail in her story reflects how this condition actually behaves. Margaret is 71 years old. She lives alone in a brick ranch house in Dayton, Ohio, drinks 2 cups of coffee every morning, and eats dinner at 7:30 in the evening in front of the television, the same way she has for 40 years. About 2 years ago, Margaret started clearing her throat. Not coughing exactly, just that small, repeated ahem. It was worst in the mornings, when her voice came out rough for the first hour of the day, and again in the hour or 2 after dinner. Her first assumption was the obvious one. Allergies. She bought an over-the-counter antihistamine and took it every day for 3 months. Nothing changed. She bought a nasal spray. Nothing changed. She bought a $200 air purifier for the bedroom and a humidifier for the living room, and she switched laundry detergents because a neighbor suggested it. Add it up, and Margaret spent somewhere north of $400 over 2 years, treating a diagnosis nobody had actually confirmed, which is its own quiet lesson, because the guessing was not free, it just felt free one purchase at a time. Here is the detail that matters most in Margaret's story. In 2 full years, Margaret never once had heartburn. No burning in the chest, no sour taste after meals, none of the symptoms she associated with acid problems, so acid never crossed her mind, and for a long time, it never crossed anyone else's mind either. It took her daughter insisting on a visit to an ear, nose, and throat specialist. That specialist did something no allergy pill can do. He passed a thin, flexible camera, about the width of a piece of spaghetti, through her nose and looked directly down at her voice box. A 5-minute procedure done right there in the office chair, no sedation, no hospital. And he saw tissue that was red, swollen, and irritated. Not from pollen, not from dust. From stomach contents that had been drifting up past her esophagus and reaching her throat, quietly, mostly at night, for years. The diagnosis was laryngopharyngeal reflux, LPR. The condition the Cleveland Clinic describes as silent reflux, precisely because so many people who have it never feel heartburn at all. 2 years of antihistamines, sprays, and filters aimed at a problem she never had. And here is why I am telling you about Margaret. Not because she is unusual, because she is typical. The throat clearing that gets waved away as allergies or just getting older is, for a large share of older adults, this exact mechanism, running unrecognized. And the single assumption Margaret made, it must be allergies because there is no heartburn, is the same assumption being made tonight in living rooms all over the country. So let's take the mechanism apart, because once you understand it, you will be able to explain it to anyone at your dinner table in about 3 sentences. Start with ordinary acid reflux. According to Medline Plus, the health information service of the National Institutes of Health, gastroesophageal reflux disease happens when stomach acid moves backward, up out of the stomach and into the esophagus, the tube that carries food down from your throat. When that acid irritates the esophagus, you feel it as heartburn. That is the version everyone knows. Laryngopharyngeal reflux is what happens when the process goes one floor higher. Your swallowing tube has 2 doors, not 1. There is a valve at the bottom, where the esophagus meets the stomach, and a second valve at the top, where the esophagus meets the throat. Ordinary reflux is a failure of the bottom door. Silent reflux means both doors let something through, and stomach contents travel all the way up and reach the larynx, your voice box, and the pharynx, your throat. The Cleveland Clinic, in its guidance on this condition, explains that it is distinct from typical reflux disease and that many people who have it do not experience heartburn, which is exactly why it earned the nickname silent reflux. The very name laryngopharyngeal reflux was pushed into the medical mainstream largely through the work of Dr. Jamie Kaufman, an ear, nose, and throat specialist who spent decades documenting how differently the throat behaves from the esophagus. And her central finding is the key to this whole video. The esophagus is built to take some punishment. It has a lining designed for occasional acid contact, it produces protective secretions, and it has muscular waves that actively sweep material back down toward the stomach. Researchers in this field have noted that a healthy esophagus tolerates repeated small reflux episodes without damage. The tissue of the throat and voice box has none of those defenses. No protective coating, no sweeping mechanism, nothing. It is far more delicate, so even small amounts of reflux material, even brief exposures, a few stray episodes a week, can leave it irritated, swollen, and coated in the sensation that something is sitting there. And there is a second culprit riding along with the acid that almost nobody outside the specialty has heard of: pepsin. Pepsin is the enzyme your stomach uses to digest protein, and when reflux reaches the throat, pepsin comes with it and can cling to the tissue up there, which means the damage is not only chemical burning from acid. It is a digestive enzyme sitting on your vocal cords, doing to them a milder version of what it does to a steak in your stomach. Now, why does one condition burn and the other whisper? Partly because of those exposure amounts, small and brief in the throat rather than prolonged in the esophagus, and partly because the nerves of the throat report irritation differently. Instead of pain, they produce sensation, tickle, fullness, the feeling of a crumb that will not move. And what does your body do when it feels something sitting on the vocal cords? It clears the throat, again and again and again. The throat clearing is not the disease. The throat clearing is the body's response to tissue that is being quietly irritated from below. And here is the cruel twist. Each hard throat clear slams the vocal cords together, which adds its own mechanical irritation on top of the chemical irritation, which creates more of the sensation, which triggers more clearing. The habit feeds the very feeling it is trying to relieve. There is one more piece, and it is the piece almost nobody connects. Much of this backflow happens when you are lying flat, at night, asleep, with no sensation at all. 3 things change when you sleep. Gravity stops helping because you are horizontal. Saliva production drops sharply, and saliva is one of your natural acid neutralizers. And you stop swallowing regularly, from roughly once a minute while awake to only a handful of times an hour in deep sleep. So nothing is sweeping the pipe clean. Which explains the signature pattern, the rough voice in the morning, the clearing that is worst in the first hour of the day. Margaret's mornings, in other words. Her voice box spent every night marinating in irritation. She woke up hoarse, cleared her throat all morning, improved by afternoon as gravity and swallowing did their daytime work, and then a 7:30 dinner followed by a 10 o'clock bedtime set the cycle up again. The antihistamines never had a chance because there was never anything wrong with her sinuses. The problem was coming up from her stomach, silently, on a schedule. And the pattern only makes sense once you know where to look. Now, silent reflux is the most commonly missed explanation, but it is not the only one, and I promised you the full picture. So here are three more people, three more mechanisms, and I want you to notice which one sounds like your house. First, Frank. Frank is 68, a retired electrician outside Tucson, Arizona. Frank's throat clearing came with a dry, tickling cough, and it had a detail Margaret's never had, a start date. About 6 weeks after his doctor started him on a new blood pressure pill, pril, the tickle began. Not a wet cough, no phlegm, just a dry irritation high in the throat that made him clear it constantly and cough in short bursts, worse in the evening. Frank blamed the desert dust. He blamed his allergies. He blamed the dog. What Frank was almost certainly experiencing has a name in the medical literature. The NIH's Medline Plus drug information notes that a dry cough is a known side effect of these medications, and multiple published reviews of ACE inhibitors, the class of blood pressure medications that includes drugs whose generic names end in pril, have examined this exact phenomenon, digging into the incidence and the mechanisms behind the dry cough some people get. And the mechanism is genuinely interesting because it explains why the cough is dry and why nothing over the counter touches it. The enzyme these drugs block does two jobs in your body. Blocking the first job is the point. It relaxes blood vessels and lowers your pressure. But that same enzyme also breaks down a substance called bradykinin. Block the enzyme, and bradykinin can build up. And bradykinin is a substance that sensitizes the cough reflex in the airway. The result is a hair-trigger throat. Not inflammation from pollen, not mucus from a cold, just a cough switch turned up to maximum by the chemistry of the pill itself. That is why the cough is bone dry, why it often lands hardest in women, who report it roughly twice as often as men in the published literature, and why estimates of how many users get it range so widely, from a few percent up to a fifth or more depending on the population studied. It also explains two patterns that fool people. The cough does not always start right away. It can appear within days or sneak in weeks to months after the first prescription, which is exactly how Frank lost the connection. And when the medication is changed, the cough does not vanish overnight. It typically fades over days to a few weeks, which is worth knowing so you do not judge the experiment too early. Here is the critical part of Frank's story. Frank did not stop his pill, and neither should you, ever, on your own. Blood pressure control is not something you gamble with. What Frank did was bring the timeline to his doctor. The cough started weeks after the new prescription, and his doctor was able to consider whether a different class of medication made sense for him. There is, for many patients, a sister class of drugs, the ones whose names end in sartan, that controls pressure through a related pathway without the bradykinin buildup, and physicians reach for them in exactly this situation. That is a conversation, not a self-directed change, and it may be the single most fixable cause on today's entire list. Second, Eleanor. Eleanor is 74, a retired school teacher in Burlington, Vermont, and her complaint was different. Less cough, more sensation. She described it as feeling like a pill was stuck in her throat all day, even when she had not taken one. She cleared her throat, trying to move something that was never there, and she noticed her scarves and collars had started to feel snug. Eleanor's answer was not in her stomach or her medicine cabinet. It was in the front of her neck. The thyroid is a butterfly-shaped gland that sits low in the front of the neck, wrapped around the windpipe just below the Adam's apple. And Medline Plus explains that thyroid disease can include goiter and enlargement of that gland, while Mayo Clinic describes thyroid nodules, growths within the gland, along with their symptoms and causes. Here is why age matters in Eleanor's story. Thyroid nodules become dramatically more common as we get older. Studies using ultrasound have found that by the time people reach their 60s, a substantial share, in some series approaching half of adults, have at least one nodule that imaging can detect. Most of them small, most of them silent, most of them discovered by accident. But when the gland enlarges or a nodule grows past a certain size, it occupies space in a very crowded piece of real estate, sharing a few square inches with the windpipe, the swallowing tube, and the nerves that run to the voice box. And the sensation can be pressure, fullness, or that phantom stuck feeling, which physicians call globus. Notice how different Eleanor's fingerprint is from Margaret's. No morning pattern, no meal pattern, no tickle. Steady pressure all day, sometimes with a visible or feelable fullness at the collar line. The reassuring context per Mayo Clinic's guidance is that thyroid nodules are common, and the overwhelming majority, better than 9 out of 10, are not cancer. But they are also not something you diagnose by feel at your bathroom mirror. They are something a doctor evaluates, often quite simply, a blood test of thyroid hormone levels, an ultrasound of the neck, and if anything looks questionable, a needle sample taken in the office with a needle thinner than the one used to draw blood. Eleanor's was benign. She needed an answer, not a panic. Third, Walter, and I want your full attention here, because Walter is the reason this video exists. Walter is 77, lives outside Augusta, Georgia, smoked a pack a day for 30 years before quitting at 60, and still has a beer or two most nights. Walter had throat clearing too. But Walter had passengers. His voice had turned hoarse, and stayed hoarse for over a month. Swallowing bread had started to feel like work, and he had a dull ache that seemed to sit in one ear, an ear that, when his doctor looked in it, was perfectly healthy. That ear detail is worth 30 seconds because it fools people constantly. The throat and the ear share nerve wiring, so irritation deep in the throat can send its pain signal up the shared line and register as an earache, which is why a one-sided ear pain with a normal-looking ear in an older adult with throat symptoms is a sign doctors take seriously rather than dismiss. Every one of Walter's details changes the conversation. The American Cancer Society, in its material on cancers of the lower throat, lists exactly these kinds of signs and symptoms. And Medline Plus notes that head and neck cancers include cancers of the throat and the voice box. The reason hoarseness is such a valuable early signal is mechanical. The vocal cords are two small folds that must vibrate evenly, hundreds of times per second, to make a clear voice. So even a tiny growth on one cord disturbs the sound almost immediately. In this one disease, the body sends its alarm early. The NIH's institute covering voice disorders is direct about hoarseness in particular. When it lingers beyond a few weeks, it warrants a proper evaluation to find the cause. And the risk factor profile matters too. The American Cancer Society's guidance on lower throat cancer and Medline Plus's page on oral cancer point to tobacco use, heavy alcohol use, and HPV infection as the major drivers in this territory. And the first two do not simply add together, they multiply, because alcohol makes the throat's tissue more permeable to the carcinogens in tobacco smoke. Walter's 30-pack years plus his nightly beers put him squarely in the group where waiting is the enemy, and the arithmetic of waiting is brutal in this disease, because cancers of the voice box caught while still confined locally are treated successfully far more often and with far more voice preserved than the same cancers found after they have spread. Walter got scoped, got diagnosed early, and got treated. And the National Cancer Institute's material on laryngeal cancer makes clear that treatment exists and that finding the disease is the step everything else depends on. 3 people, a pill, a gland, and a warning. Margaret makes 4. And the 5th cause, the ordinary one, is the postnasal drip that Medline Plus attributes to hay fever and to sinusitis, where inflamed sinuses drain mucus down the back of the throat. Here is the number that puts it in perspective. Your nose and sinuses produce on the order of a quart or more of mucus every single day, every day of your life, and you swallow it without ever noticing. Drip only becomes a symptom when the mucus changes, thicker with infection, more abundant with allergy, and starts announcing itself at the back of the throat. Sometimes it genuinely is allergies. The point of this video is not that allergies never happen. The point is that allergies became the default answer, and the default answer is failing a lot of people over 60. So here is exactly what to do with all of this, in order, starting with the item that carries a clock. Step 1. Apply the 3-week rule, today. Look back honestly. If you have hoarseness that has lasted more than about 3 weeks, that alone, per the NIH's guidance on hoarseness, deserves a medical evaluation, not another month of waiting to see. 3 weeks is the line because ordinary causes, colds, laryngitis, a weekend of overusing your voice, resolve inside that window. What persists past it needs eyes on it. And if throat clearing comes with any of the following, treat it as a near-term appointment, not a someday one. Trouble swallowing, what Medline Plus calls dysphagia, especially if it is progressing. First bread, then meat, then pills. A lump you can feel in the neck. Pain that seems to live in one ear, particularly one-sided, particularly with a healthy ear. Unexplained weight loss, meaning weight coming off without you trying. Or any blood when you cough or clear. Those are the kinds of signs the American Cancer Society lists for cancers of the lower throat, and the entire advantage in that disease belongs to the people who get looked at early. Remember, the evaluation itself is that same 5-minute office camera Margaret had. Most people who make that appointment will hear good news. Make it anyway, because the appointment is cheap. And the delay is not. Step 2. Open your medicine cabinet before you open your wallet. Read the labels on your blood pressure medications. If you see a generic name ending in pril, lisinopril, enalapril, ramipril, and your throat clearing or dry cough began sometime after starting it, even months after, write down the 2 dates, the prescription and the cough, and bring them to your doctor. The NIH's Medline Plus drug information and multiple published reviews document the dry cough some people get from ACE inhibitors, and your doctor has options, including that sister class of medications that works on the same system without the cough. Do not stop the pill yourself, not for a day. The medication is protecting your heart and your brain, and this is a conversation, not a decision you make alone. Step 3. Stress test the allergy theory instead of assuming it. Real hay fever, per Medline Plus, tends to travel with company: sneezing, itchy watery eyes, a runny nose, and postnasal drip. And it often follows seasons: spring tree pollen, fall ragweed. Sinusitis, per Medline Plus, involves inflamed sinuses draining mucus into the nose and throat, usually with facial pressure or congestion. Ask yourself 2 questions. Do I have any of those companion symptoms? And did months of antihistamines actually change anything? If the answers are no and no, you have just done in 30 seconds what Margaret took 2 years and $400 to do. You have earned the right to question the diagnosis, and the phrase to bring to your doctor is simple. Could this be silent reflux? Mentioning laryngopharyngeal reflux by name tells them exactly where to look, because it points them at the camera exam instead of another allergy trial. Step 4. Move your dinner. If silent reflux is on your suspect list, the cheapest experiment available is time. Finish your last meal of the day roughly 3 hours before you lie down. The logic is simple physiology. Your stomach needs a few hours to empty a full meal, and a full stomach lying horizontal is a pressurized container aimed at 2 valves that weaken with age. For a lot of people, that means dinner ends by 7 if bed is at 10, and the late night snack goes away entirely. And researchers studying reflux have repeatedly found that short dinner-to-bed intervals travel together with more reflux symptoms. Margaret's 7:30 dinner and 10 o'clock bedtime gave her stomach 2.5 hours every night for 40 years. The Cleveland Clinic's guidance on silent reflux includes this kind of lifestyle change as part of treatment, and it costs nothing to try for 2 weeks. Step 5. Tilt the playing field. Raise the head of your bed 6 to 8 inches, sturdy blocks or bricks under the frame's top legs, or a wedge pillow that lifts the whole upper body, not a stack of soft pillows, because pillows just bend your neck while your stomach and throat stay level with each other, which accomplishes nothing. The idea is gravity, turning your swallowing tube back into an uphill climb for stomach contents through the 7 or 8 hours when your natural defenses, saliva and swallowing, are switched off. Many people who wake up hoarse every morning find the mornings change first, within a couple of weeks, which is itself a useful diagnostic clue that reflux was the culprit all along. Pair this with the 2 lifestyle changes that appear on nearly every list in this territory: tobacco and heavy alcohol, which irritate the throat directly and weaken the lower valve on top of it, and which the American Cancer Society and Medline Plus identify among the major risk factors for cancers of the mouth and throat. Reducing them defends you on 2 fronts at once: less reflux this year, less cancer risk this decade. Step 6. And here's a loop I opened at the start, the trigger your own kitchen hides. Look at what you consume in the last 3 hours of your day. For many people with reflux, the usual suspects are the comfortable ones: the evening coffee, and remember that caffeine takes 5 to 6 hours for your body to clear even half of it, so a 4 o'clock cup is still working at 9. The chocolate after dinner, which carries compounds that relax smooth muscle. The peppermint tea you drink specifically because you think it settles your stomach. Fatty and fried foods late at night, which slow stomach emptying and stretch that 3-hour window into 5. Alcohol with or after dinner. These are commonly reported reflux triggers because several of them share one mechanism. They relax the very valve at the bottom of your esophagus that is supposed to stay clamped shut. And mint, the one everyone assumes is soothing, is one of the most reliable valve relaxers on the list. The tea Margaret drank every night to help her throat may have been helping cause the problem. I am not telling you to empty your pantry. I am telling you to run the experiment. Pick your evening staples, remove them for 2 weeks, keep everything else the same, and listen to your mornings. Your own voice will give you the verdict. Now, one more tool, and this is the one that separates people who get answers on the first visit from people who circle for a year. Keep a 14-day throat log. It sounds almost too simple, and it changes everything about your doctor's appointment. A small notebook by the bed. Each day, 4 lines. When was the clearing worst? Morning, after meals, evening, or lying down? What did your voice sound like in the first hour of the day? What did you eat and drink after 6 in the evening? And any companion symptoms: sneezing, congestion, heartburn, ear discomfort, trouble swallowing. Here is why this works. Each cause we covered today has a fingerprint. Silent reflux tends to stamp the mornings and the hours after meals. Allergy tends to travel with itchy eyes and seasons. Medication cough tends to have a start date that lines up with a prescription. A thyroid issue tends to feel like steady pressure rather than tickle, with no daily rhythm at all. 2 weeks of notes turns your vague "it happens a lot" into a pattern a physician can read in 30 seconds. And in a 15-minute appointment, which is roughly what most primary care visits allow, arriving with data instead of impressions can spare you months of treating the wrong suspect. It is the difference between the doctor guessing with you and the doctor reading the answer off the page. One caveat, and it is not negotiable. The log is for the annoying, unexplained throat. It is not a substitute for the doctor's visit if any red flag from step 1 is present. Hoarseness past 3 weeks, trouble swallowing, a neck lump, ear pain, weight loss, blood. Those symptoms skip the notebook and go straight to the appointment. If you take one thing from the last 20 minutes, take this. The difference between Margaret's 2 lost years and a real answer was never expensive, and it was never complicated. It was a single question asked in the right direction. Could this be coming up from below instead of down from above? Chronic throat clearing after 60 has a short list of explanations. Silent reflux, that the Cleveland Clinic warns rarely announces itself with heartburn. A blood pressure pill with a documented cough. A gland in the front of the neck. Genuine sinus drainage, and, rarely but seriously, the warning signs the American Cancer Society says deserve prompt attention. Every one of those has a next step, and every next step starts with refusing to accept it's just age as a diagnosis. Please remember, this video is education, not medical advice, and nothing here replaces an examination. If your throat has been talking to you for weeks, let a healthcare professional actually look at it, and bring your questions and your log with you. If someone came to mind while you watch this, a husband who clears his throat through every phone call, a sister who has been on allergy pills for a year with nothing to show for it, send them this video, because the person with the symptom is usually the last one to count how often it happens. And if this was worth your time, a like helps this reach the next person who has been blaming pollen for a problem that was never pollen, and subscribing means you will be here for the next one. Take care of yourself, and I will see you at the table next time.